I told you I'll be back live again. Hello. I'm actually back from Hamburg now. I'm at my Stamford, Connecticut office. I'm so happy to be back. I saw quite a few patients right now, and it was a great. Hamburg was a great experience. We lectured on. They have such a. It's amazing. These Germans have such great interest um, in natural medicine. It's just unbelievable. Of course, natural medicine came from you. One can argue from Germany, right? But our founder here, Benedict Lust, for naturopathic medicine, came from Germany, and opened up a clinic and a natural health food store in New York. Then went on to New Jersey to have the Youngstown, if I remember correctly, sanitarium. So we had a great time. They had a lot of great questions on different nutrients for prostate cancer, acupuncture for prostate cancer, which actually one of the questions was, can we do acupuncture for prostate cancer? I'm not sure that acupuncture per se, cures prostate cancer. I wouldn't say that, but it does seem to help with men suffering from hot flashes when they undergo hormone therapy. So I would highly recommend that actually. Hot flashes is typically what women go through when they reach menopause. So men, when they undergo hormone therapy, they get hot flashes and they get a little weak and things. So acupuncture is great for that. Hello everyone. I see a lot of people joining in now. Thanks for doing so. Ask me any question you want about men's health. I won't, anything. I just got back from Hamburg and I'm just kind of, I did that live thing out there, and it was a lot of fun. So go ahead and ask any questions. I'm ready, to answer them for you. This seems to be fun. I see a lot of people joining in now. Welcome. Um, yeah, so we were over there in Hamburg at the Martini clinic. It's funny to say Martini as a clinic, but nothing related to the drink, I think. And what a phenomenal uh, you know group there. All right, so what's the status of understanding the effects of medicinal cannabis oil on prostate cancer? All right, so that's tricky. I know that cannabis oil is being used for different conditions, different cancers as well. There is no research that I'm aware of with regards to cannabis oil and prostate cancer as of yet. Now, that doesn't mean that there's no benefit, but I just don't know any research there. I know that some of my patients are taking cannabis oil. Quite frankly, I don't know the right type to take specifically for prostate cancer. I know that cannabis is taken for epilepsies and things of the sort. It's been studied more for those kind of things. So, but it's hard to tell. Now, I don't discourage my patients who can find legally cannabis oil and take cannabis oil. I don't necessarily discourage them from taking it. I have them go on a regimen that I put together for them, and then monitor them. But again, I'm not exactly sure. There's no I know there's a lot of theories online. Hey, I've taken it. It's great. I love cannabis oil. It cured me. I don't know that to be true, and that's just anecdotal information, which I have to be careful with. So, good question. Let's see if we have any other questions coming. A lot of people joining in. This is fun. Hey there. Hi. Wow, that's great. Thanks for joining. So we were talking about my trip to Hamburg. It was amazing. They had a lot of questions about selenium and prostate cancer, how beneficial it is. And yes, so selenium is one of the key minerals that I think for both breast cancer and prostate cancer that should be measured and should be prescribed. One must be careful not to go high on selenium because any mineral can actually be toxic. So one must be careful with selenium. So I wouldn't take more than 400 micrograms a day. In supplementation, I typically prescribe about 200 micrograms a day. So that's selenium. All right, what's the question here? All right. So what's the best diet for for prostate cancer? That's a little bit tricky because well, the capless eating method, the capless, if you heard from my book, it's a lifestyle for prostate cancer, and the best eating regimen really is a plant-based, very low carbohydrate diet. I'm actually looking very closely into the ketogenic diet for prostate cancer. I think there might be beneficial aspects there, but the ketogenic diet, which means almost no sugar, not from fruits, not from carbohydrates, can be very difficult to do. So if one is going to do that, they want to make sure that there is really good benefit. I know there's a ketogenic diet for brain cancer and glioblastomas, and that's been studied, and that continues to be studied. But precisely for prostate cancer, technically speaking, from a research perspective, we don't know. What we do know is that a low carbohydrate diet is good, and one of the latest studies showed that men undergoing hormone therapy on a very, very low carbohydrate diet, around 20-25 grams a day, which is very little, actually had no metabolic syndrome. These are the side effects from hormone therapy. No bone demineralization, and did very well, better than the control group. So, but I do have my patients on a very low carbohydrate diet, but not as low as a ketogenic diet, at least not yet. There is no evidence with regards to prostate cancer. What do you recommend groups like the Prostate Network should be doing concerning promoting prostate cancer screening? Prostate cancer screening. All right. I gave a lecture a couple of months ago at ACAM, and it doesn't really matter. Those of you who know ACAM, but here's the point. They asked me, hey, should we do the Oncoblot test for prostate cancer? And what the Oncoblot test, you can look it up, is a very good test, but it's a little bit too sensitive, meaning that at least for prostate cancer, you find cancers that you don't really care to find. Some of you may ask, hey, what do you mean? I want to find any cancer. If it's in my body, I want to find it. Not necessarily. Prostate cancer, low-grade prostate cancer actually will not kill most people. Most people with low-grade prostate cancer will die with it, not from it. So that goes to the answer to your question. Who should we screen? Here's the deal. Very simple. If there's a first-degree family member who've had prostate cancer, father or brother, particularly aggressive type, the one that that can be deadly, or a relative has died from it, then you want to screen at 40 years old, okay, with a PSA test and a digital rectal prostate exam and all that. If African-American people should definitely screen at 40. They just have a higher propensity to prostate cancer, to getting it, to dying from it, to getting a recurrence after treatment, etc. So those are the two groups that, and very important, if there's a female history of breast cancer, that also increases the risk of prostate cancer in men. So that's another risk factor. So all those things considered, you want to start at 40. I typically start around 45. I think that, I think that if we can find early disease, it could be cured. And I've seen too many men in their mid to late 40s with aggressive prostate cancer, who then probably was too late. So that's that. Hey Razi, how are you, honey? Thanks for joining me. I'm doing this live thing, so I hope it's helpful. It's sure a lot of fun connecting with people. All right, let's see if we have any more questions. So how often should you get your prostate checked? After the age of 40, you should get your prostate checked at once a year. And what you're looking for is nodules. Different. It's like your knuckle, these hard segments, and that can be more specific to prostate cancer. It's a very uncomfortable test, as we all know. No one wants to put their elbows on any table or or anywhere. But it's, it's one, it could be a lifesaver potentially. So, but it's a very important test. I would argue that a physical exam is one of the most important tools a doctor has, beyond the labs. A good physical exam is key to a clinical success. Any thoughts on the use of acupuncture and Chinese herbs in addition to diet and lifestyle change? That's a general question, but yes, the answer is yes and yes. Acupuncture and Chinese herbs can be beneficial. They can increase immunity. They work very well. So the answer is yes. I use it in the clinic as well, but it depends. It has to be individualized. So I think the future of medicine is individualized medicine. So, and that includes natural medicine, of course, and nutritional medicine. So the answer is yes, absolutely. For prostatitis, acupuncture, amazing. For pelvic pain, amazing. And of course, different Chinese herbs. All right, you're welcome. They are thanking. Somebody saying, hey, I know you. Hey, Monroe. Don't leave your practice to become a worldwide speaker. We need you where you are. No, I think I will practice for forever, for the rest of my life. I just love it too much, and I love meeting different people. So I will do this forever. Love your energy and willingness to share. Hey, my pleasure, man. Thanks for tuning in. You recommended a high fiber diet. Your thoughts? Well, high fiber diet, yes, yes, a high fiber diet is great. But it's funny because these Paleolithic diets and ketogenic diets are actually very. They could be low in fiber unless you consume a lot of vegetables, and then they're high in fiber. So the answer is yes, absolutely. High fiber diet, mostly from vegetables, green leafy vegetables. I think there's a lot of anti-aging components into those types of food. So you need to keep that going. So the answer is yes, thank you, and hello. Hey, how are you? Thank you as well. When do you recommend a biopsy, and do you consider one negative blind biopsy sufficient? Good question. All right. So biopsy, and of course you're talking about a prostate biopsy. Let's see. So this is another area that has to be individualized. But what I don't do is recommend biopsies with those that have just a high PSA, unless the PSA is higher than 10, with a prostate exam that's suspicious to prostate cancer. So when there's a high velocity and there's a family history of prostate cancer, and the PSA goes higher and higher and higher and increases within 6 months or doubles within 6 months roughly, then I do recommend a biopsy. Now, of course, I recommend a MRI fusion targeted biopsy. Those are more specific. Those can find suspicious cancer cells more so than the blinded one. If you had a blinded one, then I would get it tested, do a genetic test on it called the Oncotype DX. The Oncotype DX, and your doctor can order it, can tell you what's the probability of you having a prostate cancer that's more specific to having a Gleason 7 or higher. Those that are into the prostate cancer thing know what I'm talking about. So I would do an Oncotype DX on. I do it on targeted biopsies anyway, which is this company that orders the tissue, the prostate tissue, and sends it to a lab and checks it out for genetic markers that can be compared, that can be genetic markers that can tell you if there's a more aggressive disease in the prostate. So I hope that answers your question. I know I was a little all over the place there. Sorry. Let's see here. Welcome home. Thank you very much. Great to be home. Hamburg was great, but I was very happy to see my lovely children. All right, so traditional prostatectomy versus robotic procedures. So I just came back from Hamburg, as you know, and these are amazing doctors. They're just, and this is a particular clinic that's only that focuses primarily on prostate cancer. So here's what they said, because I asked them that question, and they said that it really depends on the practitioner. So I would rather do a prostatectomy with an open surgeon who's more experienced than a robotic surgeon. And all these practitioners do both. They are trained as open prostatectomy doctors, and they do robotic. So it's best to go with the best, most. Look, if you look at a robotic surgery in YouTube, I think if you put in robotic surgery, it's an ugly procedure. I mean, the patient is lying upside down, and their stomach is inflated. So it's not a pretty procedure at all. So it really depends on the practitioner. If it's a good practitioner who's well experienced, they do open, then that's the way to go. And the literature supports that when they've compared both. There is no difference other than a little bit less blood loss in those that do robotic procedures. So that's that. All right, at 47, I had a radical prostatectomy, 5 years, and still no election. I'm not sure what that means. Maybe no recurrence. I find in certain squatting positions there is blood flow. Okay, so I assume all hopes of unrestricted erections are gone. Do you have an opinion of injection therapy for erection? So injection therapy. So this is injection therapy is a formula of 3 different medications into one formula, and that formula is injected into the penis, literally into the penis. Now, I know some of you are squirming about that. Some of these guys that are having really erectile problems are motivated to do that. Not all of them, but some of them. And what it does, it really gives you a firm erection. So ejection therapy actually works very, very well. In my clinical experience, it seems to work better than Viagra or Cialis or Levitra, particularly after prostatectomy. So yes, it works. The only problem is that it sometimes works too well, where the erection doesn't go down. So if you heard the commercials, if it doesn't go down within 4 hours, then you need to go to your doctor, call your doctor, right? Some of you are saying, hey, I'm going to call everybody if I don't get if I get an erection for 4 hours. But here's the deal. It works very well. It's not for everybody, but it works very well. And you should go to someone who actually is experienced in these injection therapies. Since MRI guided biopsies are so much better, what should we do about all the places, lost you, not using them? Seems like, okay, that's a very good question. Seems like they are providing substandard care. Love your sharing on this. All right, cool. You're right. MRI fusion targeted biopsies are not provided everywhere. And the main reason for that is because it's very expensive to put up an MRI, millions of dollars. Mostly found in academic centers for the most part, but some private clinics have them. But you're right. These type of procedures, these type of images and biopsies are not offered in many, many places. What do you do? I really believe that if you can find a place that offers targeted biopsies with MRI fusions, that's what you should do. You should do that. Now, let's just say that that's still not an option for you. So then once you do a blind biopsy, that tissue should be sent to a genetic lab like Oncotype DX to determine how the whole prostate, what's the health of the whole prostate. Okay? But if you can, once again, I want to emphasize, I think targeted biopsies are not the future. It's really what's going on now, and it seems to be, very, very helpful in terms of prostate cancer. Are you reversing prostate cancer naturally? I am an academic and responsible with what I say. To say that I'm reversing prostate cancer naturally, I think is a big statement. What I like to say is that people who are very compliant to my natural protocol towards prostate cancer are really creating a microenvironment that's hostile to cancer. Along with that, they have more energy, they can think better, they have better memory, so their quality of life improves. To say that I'm curing and treating prostate cancer with natural protocols means that somebody has a biopsy, then they don't undergo no other therapy. They just go the natural route, and then a follow-up biopsy within a year or year and a half comes up negative. That has happened a few times. but it's very difficult to say, hey, you're cured from prostate cancer. I have many men on active surveillance who've stabilized with prostate cancer. So, in other words, they had prostate cancer, they're on active surveillance, and their active surveillance is now stable. Has not Their prostate cancer is now stable, it hasn't progressed. So that's a good thing as well. So that's what I'd say. I like to say that I'm curing everyone from prostate cancer with natural therapies and supplements, but that's a strong statement that I don't feel comfortable doing. I know there are many other people out there that do those kind of things, but I don't. The only option I am here is implant. So implants for ED after prostatectomy, I think implants are great. They really are. Now it's another surgical procedure, and some guys after prostatectomies don't want a surgical procedure, and I can understand that. But implants actually, people for the most part are very satisfied with implants. So I would say yes, and you need to find a good implant guy, a good implant doctor. And you can ping me on Facebook if you like. And depending on where you are, I know a lot of good implant doctors for the most part throughout the country. So let me know if you need that information. Just want to say hi, welcome back. Thank you very much. You guys are awesome. I'm going to do this more often. I hope it's helpful for you. Dr. Dean Rafalak, hi. Hey, Joe, please run through the value and differentiation between PSA3, PSA velocity, and PSA density, and free PSA. Okay. Let's see. How do we summarize this? This could be... All right. So PSA3 is a urine test. So one has to undergo a pretty aggressive type of prostate massage and then urine in a cup. Then that specimen is sent to a lab, and they check for different RNA structures that are more specific to prostate cancer. It's very good. It works very well, but it seems like the 4K score, which is a blood test and requires no a prostate massage, is probably better at this point. But there's others now, the prostate health index test as well. There's quite a few that are also very good. PSA velocity is very good. So it's better than just PSA in terms of how the PSA changes within time. Normal PSA change is about 0.75 a year. Anything higher than that might be suggestive of prostate cancer. Not definitely, but might be suggestive of prostate cancer. PSA density. That is a calculation where you calculate PSA number over PSA size in cubic centimeters, cc's, and anything higher than 0.15 is suggestive of prostate cancer. Once again, suggestive. Ultimately, those that want to find prostate cancer need to do so with a biopsy. That's the gold standard. But all these other tests can be very suggestive in terms of, should I even undergo a biopsy? And the answer is yes, once you look at all these numbers. Free PSA, percentage of free PSA. So PSA is bound to different molecules, just like testosterone is bound to SHBG, right? So PSA that's free, higher than 25%, the lower the percentage free PSA, the more indicative it is of prostate cancer. There again, it's suggestive. There's a lot of false positives and false negatives with regards to percentage free PSA. So you got to look at everything, not just one thing. They're all very valuable, but they are none of them are perfect, and there are a lot of you have to use them all collectively to make a decision of whether or not you undergo a prostate biopsy. Okay, all right, just a few more. What does naturopathic medicine? So, hey Razi, what does naturopathic medicine bring to your practice beyond conventional care? Well, naturopathic medicine is, it's very simple actually, right? I think that all urologists are surgeons, and so they look at disease care, right? So you have prostate cancer, and they focus just on below the waistline, and that's what they should do. That's what they're trained to do. What naturopathic medicine does is actually looks at the person, right? Looks at Mr. Jones, not just a prostate, right? And you appreciate the fact that the lower half of the body is actually connected to the upper half of the body, right? So naturopathic medicine looks at the whole person, looks at the cause of the problem. It's a partnership that you develop with the patient. So yeah, naturopathic medicine. I just don't. Excuse my biases here. I just don't understand how there could be how any condition, nonetheless, prostate condition, can be treated without these tenets and philosophy of naturopathic medicine. So naturopathic medicine, I mean, everybody who's listening right now should definitely get a naturopathic doctor. But yes, I am a bit biased, but it's good stuff. All right. I am off. I am off. I'll be back. Thank you for tuning in, and I hope you've enjoyed this segment. Talk to you soon. Bye.